All right. Well, I have with me today Dr. Scott Null from Village Osteopath.
Hello.
Dr. Null is one crazy osteopath. He's a little cuckoo. No, he's good. He has a practice. It's in Noblesville now, right?
Yes, it's in Noblesville.
Yeah. Okay. So I've known Dr. Null, gosh, how long? How many years has it been since you've been in practice there?
I'd say probably we met right when I opened, so it's been 6-7 years, something like that.
Yeah, for a while. And so
Festival, right?
What?
Did we meet at the Freedom Festival or something was that
yes.
What it was?
Yeah, I think so. One of those fair things.
Yeah.
Yeah, and he had all this holistic natural stuff listed, so I of course gravitated to him really quickly. So he's one of your more holistic kind of doctors. So my family sees him and we love him. So Dr. Null, let's start by, he's got some really cool stuff in his practice. So tell me a little bit about your practice and your new location and everything.
Okay. So yeah, we moved up here to Noblesville in the Stony Creek Industrial Park. We moved up here right before Halloween of last year. And so the practice, we mainly focus on, I'd say about 80%, 75 to 80% of musculoskeletal issues from a non-surgical standpoint. And then probably the rest of stuff kind of more holistic functional medicine, family medicine type patient base for the rest of it. Yeah, so basically kind of what we're trying to get people to do is just, have less pain, move better. Most people we see are stuck in their life in some way or form. So we're just trying to get them unstuck and get moving again.
Awesome. You have a lot of really neat therapies in your office. So one of them was, I know I brought my daughter for this, for chelation, or not chelation therapy, but IV therapy because she was dehydrated. So
yes. Tell
us a little bit about your IV therapies that you offer.
Yeah, so the IV, we have a range of IV therapies. They're starting to really catch on here in Indianapolis. They've kind of been popular on the coasts for a while. I noticed they just opened a new IV bar down on Mass Ave now, so I guess that's the new hip thing. When I first started doing IVs, I mainly took over a part of a practice that was doing chelation therapy for a long time. And he retired and he said, hey, you want to take over this? And I said, sure. So I did some research on it, developed some protocols and started doing that. Then chelation, if anyone doesn't know, it's kind of an alternative treatment for heart disease and heavy metal toxicity. So then we started moving to broaden that a little bit. So we started doing vitamin IV therapy. And so we have a range of those. That's probably what they're doing at the IV bar, I imagine, for hangovers or something like that on Mass Ave. But we have a range of those from high-dose vitamin C to something called a Myers cocktail, which is a high-dose B vitamin, which can help for chronic fatigue. We also have a high-dose antioxidant with glutathione, which can help for people that are having oxidation issues. And then newly, we just started doing some IV ozone therapy, where we it's kind of mimics a lot of what I guess you could say like Lance Armstrong was doing to help his endurance, except since most people aren't professional athletes, it's actually legal for them to do it as opposed to him. So yeah, it's a way to help increase oxygenation in the blood, which leads to increased endurance.
Okay, so some of our athletic weekend athletes, do they use things like that, or is this more the real?
Yeah, absolutely. So we have people that will come either pre or post. So if you, like, let's say you're doing triathlons, for instance, we have a few triathletes that come in. Probably the ozone treatment would be good for treatment before the event, and then maybe the vitamin C afterwards for recovery. That's usually what we recommend for that. So
what about like let's say a mom that has 6 kids, all boys, tired.
Right. Yeah. So endurance wise, the ozone would be a good match for that, or the Myers cocktail, especially if they have B vitamin deficiency. So let's say they're running around, not able to probably eat as nutritiously as they would like to, just because of the everyday, work that's involved with all the kiddos. The Myers cocktail is chock full of some minerals and vitamins that really helps with energy production. So that would be a good fit. And because it's kind of a smaller bag, you're done faster, so you can get back to your everyday life.
Can they do it while they're nursing too? Like a nursing mom? Can they?
Yes, that should be fine. Everything we have should be fine with that.
Awesome.
The only thing I would kind of put a little caveat is that the ozone, it does have has heparin in there because we use the patient's own blood as the delivery molecule that kind of pulls it in, so we have to keep that from clotting. I probably wouldn't do that for someone who's nursing, just because I'd have to look that up actually. So I haven't thought about that, but yeah, it could cause some issues. I imagine maybe I'd have to check into it, but that would be one I would probably put a little caution on. But the other ones, the vitamin C or the Myers cocktail, would be totally fine.
Oh, I know when my daughter did it, she was like in heaven. She goes, "Oh, this is great."
Yeah.
she had a little vitamin C, and I don't know what else you put in there, but she loved it.
Good. Yeah, mixed up a little something there.
Yeah. Let's see. And then, tell us about the low back pain pregnancy therapy stuff you have for that.
Yeah. Okay. So, as we talked about, I asked you what you wanted to talk about, and you said something about mom. So I decided to consult best mom in the world, my wife. So, right, better say that. So, as my grandma said, I've got orders from headquarters now. So she said low back in pregnancy and afterwards, because that seems to affect a lot her and a lot of her friends. Right. I know there's sometimes when I couldn't get her fixed, I sent her over to you, and you got her all straightened out. So that was good.
We're good too.
Yeah. And I really wanted to talk a lot about maybe kind of focusing on the SI joint, because that's something that a lot of you and I both treat probably a lot of, I imagine, is sacroiliac dysfunction. Going to a traditional medical doctor, you don't get a lot of help with this. It's kind of sad. I mean, when I first opened up here, I went to a large OB practice to kind of advertise my services, thinking this is great. I've got built-in patient base here, all these ladies with low back pain, and I had a picture of like a little advertising thing. And I had a pregnant lady holding her back, until the first doctor comes in. I pull this out, thinking this is going to be great, and I was like, hey, your patients ever look like this? And he's over there scooping up the food that I brought him. And then he looks at it, he goes, yeah, they all look like that. If they didn't, I would think something was wrong. And then he just leaves. So I was like, oh, great. That's compassion like I've never seen before. So low back pain in pregnancy is very common. So I got a little picture here if you want to go. There we go.
Yeah.
So I just printed this out. This is a picture of what we deal with every day. Now, this is the low back with all the muscles removed. And the sacroiliac joint runs over here. It's where the pelvis and the spine come together. And, for the longest time, most doctors didn't even think that joint moved, which I think is pretty funny. And some still don't think it moves, even though there's plenty of research out there to show that it moves, and you can push on it and it springs around. So basically what this joint does, it kind of acts as a universal joint during the gait cycle. And so as you walk, it allows you to kind of translate that rotational force up through so you can kind of walk. And so what bothers you really bad is, basically if something's wrong with it, it hurts when you walk and when you sit and everything else. And when women are pregnant, they produce a hormone called relaxin, which helps on the pelvis get this stuff relaxed so you can spread, and as the baby comes down, things can move. Well, this joint in here is only supposed to move about 2 millimeters normally. And so when it starts moving more than that, the nerves get really fired up and saying, hey, this is not good, in which case then you have to take care of it. Mm-hmm. A lot of times women will get relief when the baby actually drops and engages a little bit because it tightens that joint up. Right. But until then, that's kind of why they come to see you, is keep that joint moving really well, and so they can continue to move and things of that nature. Now, after you deliver, what's supposed to happen is that's supposed to tighten back up because those hormones aren't being released anymore. And so as it tightens back up, let's say it tightens back up in a position that's maybe not as great as it could be, then we're kind of looking at doing manipulation at that point. So either a chiropractic adjustment or some other type of manipulation to free that joint up and restore its range of motion. But there are some times when people don't tighten back up. Either the head was huge when it was coming through and it stretched those ligaments out, or something. It could have been some kind of medication the lady was put on during when they were pregnant. Some antibiotics can cause issues to the ligaments that I think gets underplayed a lot. And so when this happens, then they're going to turn into a chronic condition. In which case you can continue to do manipulation. The problem is that it's going to keep recurring because it's not really fixing that underlying problem. And so there's a couple different treatment options we utilize. And do you use SI belts at all?
Yep, we do. Yeah.
Okay. So that's one way. You could try SI belt, which is just a big elastic band that sits real low on the pelvis. I like to use the Sorolla brand. I don't know what you.
Yeah, same one.
Yeah, so it's a real low profile one, which is really nice. Women tend to enjoy that a little better because they can wear, they can show off their new flatter stomach they have now after delivering the baby. A lot of SI belts that aren't the Sorolla brand are very thick and bulky and not. You just don't look nice wearing them, I guess. But if that doesn't work, if over time the ligaments still continue to not tighten back up, and the next step would be to do something called prolotherapy. And so, prolotherapy is an injection technique, and it's a really old injection technique.
Is it?
Yeah. So it came out around probably like the 1940s.
No way. I thought it was a new thing.
Well, it's been around for a long time. I do have my book. Hold on, let me grab it real quick. You can kind of see how old it is. Look at this textbook.
This is live, folks.
Yeah. Live. Yeah, this is
what we do.
Yeah, so check this out. This is old. I mean,
Oh, yeah.
So it was published back. The first one was published back in 1956. So that's when the first. And so some of the theory of why it didn't really catch on is that was around the same time that spinal fusion also came into being, and you can imagine what pays better. Getting spinal fusion or getting an injection into the back. So it kind of got downplayed, and up until recently has really not been looked at as a viable option for low back pain, even though there's been tons of research on it now. And the nice thing about it, it's a pretty much all natural treatment. There is some numbing medicine involved, mainly for patient comfort, because getting a shot doesn't feel all that great. So as far as a medical standpoint, that's really the only drug that's in it. The rest is sugar water. So we use a dextrose solution. And when this first started, doctors thought that it was causing the ligaments to scar down, because the theory was that the joint was too loose. The only way to really fix it is to cause it to scar down. And so early on, some people who did it, they called it sclerotherapy because it was causing sclerosis or scarring of the tissue. But recently there's been studies that show that actually causes proliferation, aka prolo, which stands for proliferation, of new tissue in the area. And so it actually causes a regenerative response in those ligaments. And so kind of going back to the picture again, unlike other joints of the body, that SI joint has so many ligaments in there. I mean, the whole joint, most joints, you kind of think of a ball and socket with the ligaments going over top like a globe around there, with the joint kind of in the middle. But with the SI, the ligaments run all the way through the joint. So there's a capsule on the outside, and then even in the joint itself, there's just tons of ligament structures in there. And so all those can get stretched. And so depending on kind of where the pain's at, you're trying to do prolotherapy to regenerate a lot of those stretched out ligaments. And I've had great success doing that. So normally kind of the treatment protocol is we do a trial manipulation to see how they do, SI belt, maybe some PT that can do some home exercise techniques to help kind of rebalance the pelvis out. And then if that doesn't work, then we switch over to doing the prolotherapy, because we just kind of assume there's laxity back there.
Right. That's interesting. I didn't know you did that. Hang on, I've got here. You can hear me. Hang on a second. Let me turn my phone off. Maybe. Okay, that should help.
Okay.
Yeah, I had I felt it rip my SI joint. When I bent over to pick up my dog, I felt like a rip on each side of my sacrum.
Mm-hmm.
Over all day adjusting people, I have an issue there. So I was actually hunting down a prolotherapy therapist or for therapy. So I didn't know you did that. So I'm going to be over.
Come on over.
Sure.
I got a spot back here you can take care of. And
that's awesome.
Yeah.
Well, thank you for that information. Now, do you also do like family practice, like more alternative
Yes, yeah. So we do we do some functional type stuff here from a family practice standpoint. There's a few caveats. I don't see kids from a family practice standpoint anymore. I will do manipulation on children. It just got to be just kind of the call schedule got to be a little too much for that. I'm trying to be available 24/7 when you're dealing with children. Okay. But yeah, I still see a lot of adults. So I do bioidentical hormone replacement or supplementation. That's something that kind of can happen to women, especially sometime around age 30. Sometimes you can start having some drop off in progesterone levels. You go to your regular MD, they diagnose you with Prozac deficiency, I guess, or something like that, where all of a sudden, you're doing fine for 30 years and all of a sudden, you need some Prozac now because you're crazy. So a lot of times what you'll see is it's just that their progesterone levels have dropped down. And so if you supplement those and bring them back up to kind of a more healthy level, a lot of that gets taken care of. And so, those hormonal therapies can be implemented, anytime there's a problem, all the way up till doing full replacement at around menopause. And I do a lot of thyroid management using natural thyroid replacement and other nutritional therapies along with that too. Okay. So out of my family practice stuff, that's kind of the bulk of it. A lot of thyroid and a lot of hormonal issues make up that.
We have a lot of
yeah, absolutely. Yeah. Well, I mean, thyroid stuff is so common and it's very underdiagnosed, I think, in pregnancy. And then with musculoskeletal issues, when your thyroid's off, your tendons and nerves swell, which leads to entrapment. And so, it's kind of goes hand in hand.
Right. Okay. Well, I appreciate you doing this. You're my very first broadcast. Yeah,
it's fun.
Great information. And I hope
we can. Too wordy.
Yeah. No. Yeah, if we can collaborate again on some other cool topic, whatever, something that's going around. So, I don't know, we'll do some more lives. But so how can anybody get a hold of you if they're interested in seeing you?
Sure, yeah. So you can give us a call to set up a new patient appointment. Our phone number is 317-491-5272. We also have a website, www.villageosteopath.com. That's OSTEOPATH. It's always a hard one. You can shoot us an email at info@villageosteopath.com. And then we also have our Facebook page, which I think is facebook.com/Village Osteopath, I think, or Village Osteo. I'm not really sure. If you search for it, though, it'll pop up. It has a little red tree logo. So we're there. So, we're on those social media things, and we have email and a website. So you can get a hold of us. It's pretty easy.
Yeah. Do you have your videos on there, your sucker video?
Yeah, they're on there. And then we have a YouTube page yet. I don't know I just started using that. So we do need subscribers though. So if you're listening, please subscribe. I only have 5 and one's me and my mom. So we got really 3, I guess. So yeah, I think we're all trying to get on this thing, trying to get more information out there and trying to learn all this. So like you said, you're using new programs today, and I've been trying to figure out how to use this tripod without the camera falling off. And so it's really fun.
Looks good. Well, I'm glad to see you enjoy it as much as I do.
Yeah.
But yeah, if you guys get a chance, check out his Facebook page and look at his videos. He's got some pretty fun.
Yeah, that's when the craziness comes out. Is doing that. That's where the real.
I love the axe murderer in the woods.
The Halloween one was really fun to do.
That was the best. So, all right. Well, thank you for talking to me, Dr. Null. I really appreciate it. Oh, okay. And you have a great day.
Yeah, you too. Bye-bye.
Bye.